So the discussion topic for tonight is diabetes. I'm sure all of you are here for that purpose. Maybe some of you are dealing with it, or you have a loved one or friend or family member that's been dealing with it, and you want to help them. Have you all seen the increase rates of diabetes? It's pretty simple. This comes from the CDC, 2017 report. So we went from 1958, and even around 1980, they note that literally there was 0 known cases of what they called at the time adult onset diabetes, so type 2 diabetes. Now it's considered type 2 because when they called it adult onset diabetes, well, it really only happened in adults, and now we're seeing it in children. So we're seeing type 2 diabetes in children, we're seeing type 1 diabetes in children for sure. We were seeing type 1 diabetes in children long before that as well. But you can see the trend going up kind of gradually. It's still going up. And then do you see the change in trajectory? I'm not going to go into it strongly today, tonight, but I'll be doing a live video on that topic of why we saw that huge change in rapid change. And there's multiple factors that play into it, and there is multiple factors that play into almost any type of disease or condition that people are dealing with, whether it's diabetes or cancer or heart disease. It's just we got to address those factors, and we got to look at the big factors, the things that have changed in our environment, the things that we're doing to ourselves, or the way we're taking care of our bodies or taking care of our children. You know, if I could say one thing to all mothers, if you want to prevent type 1 diabetes, please, please, please breastfeed your children far and longer than just a couple months. Substantial, because it really protects their immune system against activation. A mother's breast milk is in essence the baby's immune system, thus not in protection, and it protects the baby against ingestion of viruses and bacteria, because the mother's immune system is actually going to kill those things before it even gets into the baby's body. And they see multiple different infectious diseases and even parasites and things like that that are known to trigger pancreatitis, inflammation of the pancreas, and thus leading into damaged cellular death or inflammation around the pancreas, and then there's an infection in the pancreas, and then you have the immune system come in and it tries to attack and get rid of those infected cells, well, then at the same time it's destroying pancreatic cells. And then if that infection remains there, you can eventually lead into type 1 diabetes. So moms, please be the immune system the way God intended it for you to be your baby's immune system. You can really substantially, and type 2 diabetes as well. And then ladies, you get a benefit there as well as a reduction in your breast cancer risks and stuff like that. So you benefit along with your children benefiting. So just kind of mentioning that quickly, but this is where we're at, and this is what we're supposed to be expecting. And I'm going to read a couple quotes from this, and I'll show you here in a second. But the number of U.S. kids with diabetes could skyrocket, or is expected to skyrocket, because it's been, again, just flipping back here, because it's been skyrocketing. Okay? Expected to skyrocket. They're actually saying that as a society, we're not going to have the medical tools. There's these estimations that we're going to run out of insulin eventually. We won't be able to produce at the current production lines and factories that we have. We won't be able to produce enough drugs to be able to medicate all these individuals dealing with diabetes. Now, so to think about that, you might have heard this quote before. It came from one of the original medical texts in Chinese Chinese medicine. And it said, the superior doctor prevents disease, the mediocre doctor treats the disease before evident, meaning before it's symptomatic, before it's causing great harm. And we'll talk a little bit about how we could actually be applying that type of medical approach with the evidence we have here today, but yet not utilized. And then inferior doctor treats the full-blown disease. So what do we have a bunch of in America right now? You follow me? Now so going back to this article right here, I just showed you that because here is our CDC's Division of Diabetes representative. This doctor says, as a society, we will need to plan and prepare for the high quality care of these children. So which doctor is he? The head of our Centers for Disease Control and Prevention. It's an oxymoron when the representative dealing with diabetes or the head of the diabetes, arena at the CDC is literally saying, we're going to need to prepare to treat all these diabetic children. So again, can somebody please answer me? And you can answer me online too, so on Facebook and everywhere else. What kind of doctor is this guy? Yeah, he's an inferior doctor. So we have inferior doctors, and hence the reason we're seeing this occur. The CDC has been guiding us. It's been driving this ship for many, many years, and we're going in a really bad direction. You all agree? Okay. So, I mean, as a society, I think most people get that. They understand that. And a lot of times you mention that, and it's like, what do we do? Well, we need to bring awareness that we realize that what these doctors of the CDC are saying and doing, they're not driving us in the right direction. And what I would mention to everybody here is just read the article, CDC, or Centers for Disease Control and Prevention, Protecting the Private Good. And Ashley, you can probably link to that, the Centers for Disease Control and Prevention, Protecting the Private Good. The British Medical Journal article actually points out several instances where the CDC has purposefully done research to cover up harms from chemicals we use in farming to medications, drugs, how they get paid directly from industry, how their representatives go from the CDC, a government organization where they can really dictate what drugs are allowed on the market, what drugs are recommended, what we use to treat people with these illnesses, how we quote unquote prevent these illnesses, all this stuff. And then they go from work from the CDC directly to the pharmaceutical industry. So it's really just a springboard for a great million to multi-million dollar, career, in the pharmaceutical industry is what people are using now the CDC for. So the reality is that we've just allowed it to corrupt our system. One of the best quotes I love from that article is, as a society, we have to get the government to reject the devil's bargain. That was a UCLA professor of ethics, Dr. Hoffman. He said, as a society, we need to get the government to reject the devil's bargain. What it is, government officials and our government Congress members are doing deals with the devil. They're placing money above the lives of our children right now. And is it okay if I just this is my heart, this is who I am? Like, I would rather see no more patients, no more children walking in my doors with diabetes. I would rather have that. I make money by helping these people get well, but I would rather not have to help those people get well. I would rather see them well. Maybe we need to get an election system for our heads of our CDC, don't we? Maybe I'd have a shot at that one. But, so just an idea, why not start testing vitamin D? Literally, they say across the board, it's well over 90% of individuals dealing with metabolic syndrome, hyperglycemia or high blood glucose levels or high sugar levels, they're dealing with a hormone deficiency, and vitamin D is a hormone your body produces from sun exposure. So highly recommend getting out in the summer, playing in the sun, doing those things. You got to expose your torso. You can't shower right immediately following being out in the sun. If you wash the oil off your skin, you actually won't absorb it or absorb nearly as much. If you use sunscreens, you block the production of vitamin D because you block the UVB rays that are necessary for the production of vitamin D. So we got to realize that. I'm not saying everybody go out in the air and get burnt like a crisp, but sun bathe a little bit, don't burn. Okay, burning is harmful, causes oxidative stress. Okay, so don't burn, but get some sun. Okay, why not test? Do you follow me? More information on it, the associated vitamin D and insulin resistance and beta cell dysfunction. So they actually dysfunction, not functioning properly. So they need this hormone, your beta cells, your pancreatic cells. Your pancreas needs this hormone. So why not check these levels and start working on dietary changes that can bring these things up? And guess what cow's milk is advertised to do, though? I should have put this in there. I didn't even think about it, but I do have another research article on the early introduction of cow's milk into the diet of an infant, the higher likelihood they are of having type 1 and type 2 diabetes. So if you introduce cow's milk which are advertised. So you know what I mean? I was like, oh shoot, somebody's gonna run out there and be like, I need to give my kid all this vitamin D through milk, you know, because that's what TV salesman says I need to do. So liver and diabetes. Why not check liver enzymes? Why not look at the liver function? Non-alcoholic fatty liver is an epidemic these days. Now, I want to ask you though, so alcohol can cause it, but now it's fatty liver from non-alcoholic lifestyle, eating way too much sugar basically. But what is another way somebody could actually, it winds up being technically alcoholic fatty liver, but it's not the person who's the alcoholic. What's another way? It's a unique finding they have here recently, which we've known for years, but like here, I think in the last couple months, they actually had an article out and then mainstream media about it. What they find could actually cause fatty liver from alcohol consumption. Bacteria in the microbiota within your digestive tract. Some people have a dysbiosis. They have disruption of their bacteria in their digestive tract, and it actually ferments things in their gut, producing alcohol. And so their body is consuming alcohol, but it's being made within their gut. And even some people, if it's severe enough, they can literally walk around and like a breathalyzer test would come positive. And feel drunk all the time. Talk about cheap drunk, right? Cheap day. All right, let me see if I can, Ashley, I want to check online, make sure there's any comments or anything like that. I'm not sure if I can do that. You might run up here real quick. So unique situation, so looking at the gut, and I'll show you that. American Diabetes Association, I stole some of their slides from a presentation they did, and I'll show you those things and just say, you know what, here's the information, we know this, they know it, why don't we start applying it? So, therapeutic potential of milk thistle, which I put right after, you know, liver dysfunction, liver problems, because milk thistle is literally the #1 most widely studied herb, and ultimately more evidence to support its beneficial effects on liver function and liver regeneration. It can literally regenerate and repair cirrhosis of the liver, alcohol fatty liver, drug-induced liver damage, all these things, hepatitis-induced liver damage can be reversed with milk thistle. So milk thistle is one of God's just most fantastic herbs that I just simply love. I always think that sometimes I wonder if God is like just kind of giggling to himself when he made some of the most potent medicinal herbs out there. Because you ever tried to harvest milk thistle? Anybody tried to do that yet in your life? I have. It's not fun. I mean, you get like some cow skin gloves and you pick those things. Or like stinging nettle, you know, really good for your immune system, prostate health, all kinds of stuff. Anybody tried to harvest stinging nettle? This guy did. Nice. Is there a little hazardous? Is it hazardous? It stings. There's a reason it's called. I'm always like, God, why are some of the most potent medicinal herbs so painful to harvest? He's like, well, you got to work for it. You know, I put you in the garden to eat in, and then, you know, you ate the apple like I told you not to. And it's not Eve's fault because Adam was standing right beside her and he didn't say anything about it because she didn't go find him. You know, anyways. Off track. But that was just, you know what I mean? Like I remember this, literally I'm harvesting stinging nettle in the woods and I'm like, this is really painful right now. Even though I'm like trying to wear these longer gloves and stuff like that, I'm like, this is tough. I'm like, are you laughing up there? Dandelion root, or dandelions alone. Just eat dandelion leaves, please, during the summer and even late fall, winter. You know, when you find these dandelion leaves, eat them. Okay, don't spray them, eat them. They're more medicinal, they have more minerals in them than kale does. So if kale is a superfood, you know, these cruciferous vegetables, your mineral content, this is your mineral supplement, okay? Dandelion leaves are a tartness, a bitterness to it. Bitter herbs, you know, vegetables need to be incorporated in our diet. They help us produce or stimulate our body to produce more gastric enzymes and juices and acid to help break down our foods. So using medicinal herbs, I was just texting with another patient today. She was asking me like, okay, I'm taking Oregon grape, which is one of the most beneficial, potent medicinal herbs for a bitter herb for production of gastric juices, enzymes, pancreatic enzymes to help your body break down your food. And we only do like 5 to 10 drops, and you put that on your tongue and you let that bitterness just soak in there for a bit. And it substantially increases the ability for the body to start producing those pancreatic enzymes to help your body break down your food. And she's like, should I do this the rest of my life? I'm like, that's one of the herbs that I would probably say. It's not a necessity. If you're incorporating dandelion, you eat a dandelion leaves in your salad today, you don't need it, all right? But you know what? If you don't have bitter herbs in the foods you're eating, you know what? Take a bitter herb and put it on your tongue before you eat, okay? Just one simple way of doing something to help your digestive system. Pretty cool conclusions here, therapy. Therapies originating from Western medicine, that would be drugs, are costly and poor availability for the majority of the global population, especially those with in less developed countries. But diabetes is less prevalent in less developed countries. Hence, what do you think some of the factors are that cause diabetes? It's our sad American diet, standard American diet. Dandelion has been considered a key anti-diabetic plant because of its anti-hyperglycemic, so lowering of blood sugar levels, its antioxidative effects, which are absolutely crucial. That's one thing about like medication use. You look at medication use, you almost always see in almost every single person that's dealing with diabetes, things get worse and progress over time. Who's dealt with that themselves? If you might raise your hand, you've seen your medication need to go up and up. You've seen issues with family members dealing with eye problems or infections or inability to heal or ulcers on their body. I watched my grandfather go through all that stuff, And yet now that I think about it, or now that I've studied all this stuff, I'm like, these studies were available long before my grandfather was just on the fast track downhill with his diabetes, and in fact was being seen by one of the best cardiology clinics considered in the world, Cleveland Clinic. And yet they didn't put him through any type of nutritional strategy to reverse or arrest his heart disease and his diabetes, and yet they could have. And we'll go through, the evidence is there, and in fact they say most doctors are trained to think in school still today that diabetes isn't reversible. That was the latest publication in the British Medical Journal. So anti-inflammatory properties, all those antioxidative, anti-inflammatory properties that come from herbs they don't come from medications. And that's one of the things is the oxidative stress, the inflammation in the body, those are the things that cause a lot of the damage. So yes, higher blood sugar levels will cause more inflammation and more oxidative stress and more tissue damage and cellular volume increase and thus cellular damage through that mechanism. But the reality is these are the factors that cause diabetes oftentimes, are these inflammatory mechanisms, these oxidative stress mechanisms. So the underlying mechanism that cause the disease or dysfunction in our body, that cause the damage to the liver, cause the inability to control the sugar. So those things that caused it are still there. You're just medicating the blood sugar into better numbers, which technically saves a person's life in an emergency situation because their blood sugar went way out of control. It could kill the person really quickly. But it's not healing the person. Does that make sense? These herbs have the potential to assist in your healing, okay? Therefore, new knowledge for improving diabetes treatment can be generated from this research, which is certainly able to reduce the impact of type 2 diabetes on the world's social economic burden. Just a massive body of research reviewed in this article, all right, in this peer-reviewed medical study. Yet, again, I go back to what does our CDC official say about the rates of diabetes? Did he say we're going to have to grow a whole lot of dandelion root? No, he said we're going to have to be ready with great care for all these children who are developing these conditions because we're not really doing anything to prevent it. Vinegar improves insulin sensitivity. So I'm just giving you a couple things you can start to apply right away in your life, all right? If you don't like vinegar, well then you can buy our Digest Well supplement because it's dried vinegar and it has the same beneficial lowering of the carbohydrate sensitivity or the insulin sensitivity. It improves insulin sensitivity and lowers the sugar response in your bloodstream. So just simple things that can be done for everybody out there with relatively almost no risk whatsoever. I will say this with anybody who's dealing with, and if you're on medications force a pathway, herbs improve a pathway. So if I don't have diabetes. If I take Dandelion Root, there's benefits to my liver, my physiology, there's protective things, there's antioxidant capability that it gives my body, it improves my body to do. Now, I'm not gonna like, my blood sugar go down, because it's not forcing a pathway. Drugs do though. So if you start changing your diet, you start taking herbs, guess what can happen if you're on a drug? And whose fault is it? Let's make sure that we clarify as we answer this question. What can your body do? If you start doing the right things, so it's kind of like the clause here, if you start saying, oh, dandelion, great, I'll give that to my child with type 1 diabetes, which would be beneficial to them, the herb would be, but if they're on insulin and it improves their blood sugar numbers, that insulin given in too high a quantity could do what to them? Bottom them out. But whose fault is it? It's the drug. Do you follow me? It's not the herb, because the herb won't force a pathway. It won't make you do something worse than, go out of balance. So that's what's really cool about a lot of these herbs I'm going to talk about. So another study, Endo 2009, use of artificial sweeteners linked to twofold increases in diabetes. And some people will say, well, those who are overweight and obese and dealing with diabetes are recommended to take these things. But yet they show that even things that hit your mouth that are sweet cause physiological responses, cause the preparation for blood sugar levels to go up. So it causes the spike in insulin after ingestion of something that gives you that stimulation, that neurological signal from your taste buds to your brain saying, hey, here comes sugar, your body starts to produce and release insulin. If you do that, you increase the likelihood of becoming insulin resistant, all right? Losing your sensitivity to insulin. So bad issue there. So again, sugar industry and coronary artery disease, we know that, okay, sugar is bad, but yet the industry actually did, they bought and paid research studies to demonize fats. And when we got rid of fat to increase the taste, we increased sugar, carbohydrates, starches, all those types of things. So fat is actually good for you. Healthy fat is though, okay? Not trans fats, the fats that are made from vegetable oils and things like that, that oxidize really simply or really easy. Coconut, avocados, nuts and seeds, all those things are massively beneficial for you, okay? Diabetes drug linked to higher risk of death. So this is where I'm just gonna hammer it home really quickly and just say, guess what? If you, I always think to myself, am I the only one that thinks this way? But I wanna go through some of these articles and then I want to just field some, I want you guys to just tell me what you gathered from it. Higher risk of death, this drug, all right? And actually this drug, Avandia, was pulled off the market in multiple other countries. In the aftermath, the drug company actually was found guilty of lying to the FDA about the safety of this drug. Actually seeing more people dead from cardiovascular events in the drug treatment group versus the placebo group. So they lied and people died because of it. Meteor scandal, so a different drug. Scandal in French, medical community, it rocks the medical community. I'm like, they lied to you how many times? Why does it surprise you? Why does it rock your foundation? Why does it, you know what I mean? How many times do they have to lie to our medical physicians till they'll finally get it? So that's a different drug. So there's two of them. Diabetes drug taken by thousands is linked to cancer of the pancreas and other serious health problems. FDA says Takeda diabetes drug raises cancer risk. So another drug. So there's two increasing cancer risk. Novo Nordisk will pay out $60 million to settle Victoza marketing lawsuit. They illegally marketed and lied about the safety of this drug. So there's three drugs they lied about in just diabetes alone. And those cancer risks, they're found to actually be hiding those cancer risks. Why drugs don't help diabetic patients' hearts. As I went through those real quick, and I could literally say I could do this all day long. But I gave you how many there? So we went through 1, 2, 3, 4, 5. Okay, we went through 5 there real quick, okay? What strikes in your spirit, in your mind right there as I went through that? Some of you just shaking your heads. Somebody just tell me what comes up. Just the tip of the iceberg, yeah. But our CDC says this is the best things, drugs are the best things that we can be doing. Does it take a scientist? Do we need to do scientific studies to figure out that we probably should not trust the drug industry anymore? Now, in your heart and spirit, and this is one thing that I don't know if anybody else, you may be on the medication. Somebody out there on Facebook or Instagram may have a loved one that's on this medication. If you take them off the drug because you're like, those crooks, those criminals, they killed people for profits. And I hope that's what you think. And that's what's in your, now that I said it, you're like, okay, yeah, they're crooks, they're criminals, they're murderers. Do you follow me? If I lied about what was in this and I knew it was going to kill a bunch of people, I said, it's really good. It helps you with this disease, that disease. And I sold it to everybody. And I was an individual, not paying our politicians for their, their campaign funds. They're the #1 contributor to campaign funds for our politicians, drug companies. Why do you think criminals and murderers can go free? I mean, on this subject, it's like, did y'all hear that the Sackler family, they were the family that came out with the first big opioids? They're billionaires. Like Forbes magazine they made like Forbes magazine top like 15 billionaires at one point in time here recently. Their business filed bankruptcy. They're billionaires that filed bankruptcy because they lied about the safety of their drugs and they killed people for profits. They're billionaires still, but we're able to declare bankruptcy. Nice work, government, courts. You did really good. But what can we do? What can we do? Do you all agree with me and with where my heart and spirit is that I'm like, we need to do something that actually stops this plague and epidemic of taking advantage of sick and suffering people by the pharmaceutical industry? What I would say is, yes, go ahead.
Oh, I just wanted to make sure you covered what you were started to say.
Yes.
People already on the medicine.
Yes. That it's not like, don't get in your spirit. What I'm going to say is, I want you guys healthy. I want you well. I want your families well so that you won't be funding this industry, these murderers. Do you follow me? That's what they are.
So
all right? But don't quit the med.
You're right.
Yes. So you asked me what I was saying there, and then I got, I'm ADD, ADHD. A little bit. I never took the drugs, and if my mom tried to give it to me, I'd put it underneath my tongue, which is probably not the best place to hide the drug, but I did. And then I'd go outside and spit it out. But yeah, don't quit the meds right now. That's not what I'm saying. I'm saying, but please, if that stirs in your heart and your spirit to say, you know what, if I can get well, if I can get healthy, and I don't need to take these drugs, whatever it may be, maybe it's metformin, which is probably the safer of any choice, but the reality is it's not good for you. It's not the answer. It's still funding the drug companies. Do you follow me? So if you can get healthy, we can cut out the financial capability, hopefully. That may be delusions of grandeur in terms of trying, a goal that's a little bit too lofty. But, each person that we see get well is going to live longer. They're going to be healthier. They're going to pass down, better habits to their family members and their kids and their grandkids and those things. And ultimately, they're going to benefit from that. Their family's going to benefit from that. Why drugs don't help diabetic patients' hearts. So, American College of Cardiology researchers presented 3 studies revealing that some of the most widely prescribed medications reduce the risk of heart disease in type 2 diabetes patients appeared not to provide much benefit at all. In fact, they believe that because most patients died of heart disease, they said they believe that they would be lowering heart disease risks in diabetic patients. So by using the medication to treat factors like high blood pressure or increased cholesterol, they would be reducing stroke and heart attack risks in these patients. But doctors, they did that by assuming. They assumed they would be also reducing the risk in people with diabetes. What do you get when you assume? Yeah. And in the aftermath of this, they actually said that there was no reduction in those heart risks, and actually harm was done. I think I got it. Maybe I got it. There it is. Effect of statins on fasting blood glucose in diabetic and non-diabetic patients. Statin use, in the conclusions down at the bottom, statin use is associated with a rise in fasting glucose levels in patients with and without diabetes. Women, if you took statin medications and you developed diabetes, it could be because of your statin, your cholesterol drug. It's one of the worst and biggest lies people have been led to believe is that cholesterol is bad for you. Cholesterol is a response. It responds to what's going on in your body. If inflammation is taking place, your body produces more cholesterol to heal the damaged tissue. That's, in essence, simply put, what it does. If you have hormonal problems, guess what? Your body may produce more cholesterol because it is the foundational building block for every hormone in your body. There's a lot of reasons your body may be producing more cholesterol, and if you take cholesterol medications, all you're doing is disrupting the body's responses. And if it makes diabetes, if it causes diabetes, it's going to make diabetes worse. Everyone is at fault with insulin prices skyrocketing. There's plenty of blame to go around. Mortality. The numbers are just baffling. It was, I think it went from like $100 and some for like 20, I forget the exact measurement of how they did the insulin, to like well over $1,000 for the same vial of insulin now. Some people are reliant on that. They'll die if they ain't got it. It's kind of like saying, you know what, there's a hurricane, everybody's got to evacuate, I'm going to up my gas prices. Because you got to get out of town, and you got to get gas to do it. Do you follow me? They will literally take gas station, owners to court and sue them if they do that. Not the drug companies, though. Go ahead and take advantage of sick and suffering people. Mortality, other important diabetes-related outcomes with insulin versus anti-hyperlipidemic or hyperglycemic therapies in type 2 diabetes. So type 2 diabetes only, okay? Not talking about type 1 diabetes, so insulin dependent. This is not dependent on insulin, but when they use insulin, guess what happened? In people with type 2 diabetes, exogenous insulin, so insulin therapy, was associated with an increase in diabetes-related complications, cancer, and all-cause mortality. And how many of you know somebody that has type 2 diabetes and is taking insulin? Yeah, got quite a few people shaking their heads. They literally just, their doctors, increase their risk of dying, developing cancer. Insulin-like growth factor, and insulin is a growth hormone. Cancer. So, I already went through those statin ones. World's first anti-aging drug could see humans live to 120. Something I didn't put in here, but I thought about it when I actually put this slide in there. It's in Genesis. I won't breathe life into men and women endlessly. I'll number their days to like 120, I think God said in the Bible. And then I'm like, that's pretty darn cool. It didn't say, I'm going to allow somebody to invent metformin in the future, and then thus people will have life breathed into them or drugged into them to 120 years. God didn't say that. Anyways, I just thought it ironic that they threw out the 120 number when I think that's pretty. And I'm not a biblical scholar, so, this is just for comedy purposes. Everybody get a little chuckle there. What's advertised in the aisle just below cookies? Hey, if you're grabbing your cookies, come on by in Publix and we'll give you some free metformin.
That's a real picture.
Yes, that's a real picture, yes.
Here?
Nah, I didn't take that. A friend of mine took it. So, yep. Efficacy of Berberine in patients with type 2 diabetes. If you read the study, is actually just as effective, actually slightly more effective. Small study, but again, God's herbs were more effective or just as effective in lowering sugar levels as metformin. So you don't even need metformin. Now, I want to say this. All right, I periodically take berberine, can come from Oregon grape, all right, and then it can come from golden seal, all right. Golden seal is my choice for using with patients who are dealing with diabetes, if we want to wean them off the medication, they want to get away from the drugs. But what I do is we cycle with that. We don't take it, and I don't want people to say, I just want to take something instead. That's like a functional medicine idea and way of treatment is, instead of a drug, let's just do a supplement, or let's do an herb alone, all right? I'd rather say let's work on the body and correct the underlying causes so you're no longer dependent for the rest of your life on anything. You're living free. Does that make sense? So that's the goal. So don't just say, I'm going to switch it and I'm just going to take this for the rest of my life. I'd be like, okay, that's kind of good. You're in the right direction. You're relying on Mother or Father Nature, our Father. I always hate that. You know why, but society, man. Anybody ever watched the movie Into the Wild? No? Golly. If you want to know why people call me the Wild Doc, my wife Lily, she was away for the weekend. Into the Wild, it's a sad, but yet to me, and that's why I said society, and I quoted the Into the Wild. It's about a kid, he graduated from college, and his dad was like big businessman, and he wanted him to just, get a great job, make lots of money. They wanted to buy him a brand new car after he graduated from college. They just, they drove a Cadillac. They wanted him to look good in their town and all this stuff. And he runs away from home and then just becomes, a rubber, what do they call it? Anyways, a rubber tramp. He called himself Rubber Tramp, and basically he'd walk around all over the U.S. and then traveled up into Alaska, and actually wound up in Alaska and crossed a river. And there's a true story. Kid crossed a river during a snow time when there wasn't the melt-off, so the river was very small. And then when he tried to get back after running out of food supplies and stuff like that, and he ended up dying. But yet I was joking with my wife, I'm like, if you come home and I'm not home, just check the magic bus up in Alaska. I just want to escape from society, looking at all this stuff and all that, Anyways, so. But yeah, I don't know where I was going with that, but that just because I said society, man. So remission of type 2 diabetes, mission not impossible. Remission or reversal, healing is what we should call it. A lot of times they want to, and this is the thing, is reversing diabetes is possible, but it's rare. Rare, why? Watch this. The article literally says that the study in the British Medical Journal notes that doctors may not be aware that type 2 diabetes can be reversed. Isn't that sad? It's becoming more and more aware these days, but because you get patients that literally come in, their doctors, and be like, I'm trying to work on reversing. Oh, no, and I've had patients that I've been working with that have literally gone to their doctors and you've been told, you can't reverse it. Once you're diabetic, you're always a diabetic. They identify you by your disease. That's wrong. You're a human being, you're a child of God, you are not a disease. Do you follow me? So, but that's sad. Beating type 2 diabetes into remission. Type 2 diabetes is generally perceived as progressive and incurable. That's the thing is 2017, this British Medical Journal literally saying in the first statement that type 2 diabetes, even though it's reversible, it's generally perceived by medical physicians to be progressive, meaning what? They're not taking care of the underlying causes. You follow me? And incurable. But yet it's curable, and it doesn't have to be progressive. It can be reversible. So they say that now the trends in medical specialties, not just general medical practice, diabetes management is beginning to focus on reversible underlying disease mechanisms rather than treating symptoms and subsequent multi-system pathological consequences. So the multi-system issues that can develop because of progressive medicated diabetes. Okay. However, management and guidelines focus on the use of anti-diabetic drugs with only lip service paid to diet and lifestyle advice. Only lip service. Eat right and exercise. How many of you have been told that? You've been to your doctor, if you just eat right and exercise. You know what? Don't complain to me. Eat right and exercise. Ignorance of nutrition is no longer defensible. July 1st, 2019. This is a fun read for me, and online, and then anybody here, it'll be posted on the wilddoc.com. So the website, you can get every one of the links to every one of these articles, every one of these research articles. You can read this stuff for yourself. You can use this stuff, equip yourself to go and talk to a friend, a relative, and basically walk them through this video maybe, or share the video with them and share these articles so that you can be like, hey, you can reverse this condition. I don't care what your doctor says. Here, let me show you this article. Doctors didn't know it was reversible. So if your doctor's telling you that, then he's not keeping up with the most current evidence and scientific research. Do you follow me? And walk your friend, your family member out of that just, the shackles of medicine, the shackles of and bondage of disease. During a patient's entire stay in this article, okay, ignorance is nutrition. So let me read the first part here. It was the middle of the night and the patient's intravenous IV line was clogged. Having refused the recommended foot amputation, the patient receiving IV antibiotics to fight a festering infection, a complication of outstanding diabetes. During the few minutes it took to replace the IV catheter, the patient let me know that whatever pride I had in phlebotomy skills was unjustified. The needle stick only added to the misery of their hospital life. And that's sad but that's, people who are being medicated and stuff and not led and taught by their doctors, they get very upset, frustrated. So, some of those nurses, probably this one right here, she was only wanting to help the person, but the whole system, and watch what she says. And she literally said to him, I found myself thinking, why not just get the amputation over with? It seemed that the patient was only delaying the inevitable. She said later that during the patient's entire stay, no one on the medical staff had talked with the patient about the fundamental cause of the problem. She said, we were ready to amputate, but never started a discussion about improving diet. Cinnamon improves glucose lipid levels for people with type 2 diabetes. All right, at 1, 3, or 6 grams were used in the study. Improving triglyceride levels, it's a strong antioxidant, and improves insulin sensitivity. All right, serum glucose, triglycerides, LDL cholesterol went down because there was lower inflammation, and total cholesterol level improvement as well. It is not going to block the production of cholesterol, but it's going to lower the inflammation that drives the need for more cholesterol to repair damaged tissue because of inflammation. Does that make sense? All right, so anytime they mention cholesterol, it be used as an indicator but not used, it shouldn't be drugged, okay? It shouldn't be lowered even naturally. Direct lowering of cholesterol, something like red yeast rice and those things, I disagree with. So, chronic subclinical inflammation as part of the insulin resistance syndrome. So you've got to get to the sources of inflammation. And there are many different factors that can add to that. Newly discovered immune cell linked to type 1 diabetes. And this is just published. And it doesn't, rogue defender mistakenly spurs attack on insulin producing cells in the pancreas. No, it does not. Your body doesn't make mistakes, okay? They literally go through and this immune system for some reason is attacking the pancreas, but they can't figure out the exact mechanism by which your immune system would attack your pancreas just randomly. There's things called molecular mimicry, or if you're exposed to something or injected with something that mimics the proteins on your cells, on your pancreas cells. If it mimics that, your body can be like, oh, they're wearing the same uniform. So if somebody mimicked, if you were overseas and you would never want to put on the uniform of the enemy and mimic them and then run towards the U.S. forces because they might shoot you. So don't mimic them. Do you follow me? So that's molecular mimicry. And then there's infections, acute pancreatitis, inflammation and damage to the pancreas. And that actually one of the major causes of pancreatitis can be actually blocked bile ducts. So if blocked bile ducts and liver dysfunction, bile problems, liver problems, gallbladder problems, when they block that up, you can't get the pancreatic enzymes out. They back up, swollen, inflamed pancreas, pancreatitis, damage then takes place in cellular death. The immune system has to clean that up. And then there's infections, and they've tied it to enterovirus infections, to mumps virus infections, as well as injections and hepatitis B injections. I just kind of mentioned it, so I'm going to run back here real quick. What year? What year did we start vaccinating infants on day 1 of birth with the hepatitis B vaccine? Anybody know? 1994. And within 3 years, you see the trend changed. 1997 and beyond, the trend changed. And studies have been shown that molecular mimicry, or because they inject you with a virus, and if it gets into the pancreas, inject it, you're bypassing the mucosal membrane, you're bypassing the primary barrier immune system. And the system that's supposed to prime you to get ready for an infection systemically and get you prepped and ready to go and be able to clear it and fight it off. It's already behind enemy lines really quick. So, and there's other than just that one. But that's just showing you guys, like, we need to question why we're doing it. I've got studies from other nations that have, you know, population-based, like hepatitis B infections are very, very prevalent. And if mother breastfeeds her infant, they would vaccinate babies with hepatitis B on day 1 versus 6 months. And literally there was no difference in vaccinated babies versus waiting or not vaccinating if they were breastfed. Yep. Because if they're breastfed, mother's immune system actually, she's already producing the antibodies, and it can prevent infection in the infant. So, cool stuff, I think. Immune system. So, this is currently American Diabetes Association. This is their chart. This is their diagram. And what they showed is they said, they always throw in genetic susceptibility as like, this is what can happen, all right? I call it immune susceptibility. Your immune system can turn on genes or turn genes on or off. Your environment, how many infectious diseases you're surrounded with, how many chemicals you're surrounded with, how much stress you're under can change and alter the expression of your genes. That matters far more than your genes do themselves. Does that make sense? You know how they say that genetics load the gun and environments pulls the trigger? All right, so who would be charged with murder? The person who loaded the gun or the person who pulled the trigger? Okay, so let's just stop pulling the trigger. Do you follow me? Let's figure out how to do that. All right, so even if we got the loaded gun a little bit, islet cell autoantibodies environmental triggers occur, okay? So again, pancreatitis, infections, those toxins, those different things start that process towards, and this is type 1 specifically, all right? Islet cell autoantibodies are formed, subclinical disease, so the pancreas starts to deteriorate because the immune system is killing it off. And then you start to get the phase 1 insulin responses, all right, it's trying to produce more, but then eventually the sugar, and then you're now type 1 diabetes because your pancreas is so far gone. And then if you can identify it here, why not say, you know what, how do we get the immune system calmed down? How do we fix that? How do we clear that infection? How do we balance out the immune system? And I'll show you some ways that they've actually said that we can do this with autoimmune diseases. And if you have live cells, you can actually start to regenerate those live cells. They will divide. Differentiation, American Diabetes Association again, okay? This is October 9th through the 11th in 2015. Environmental factors, obesity, clearly important. Obesity is an environmental factor. Environmental factors technically lead to obesity. Environment being what food you're surrounded with and you eat, all right? Obesity isn't the environmental trigger. But again, how you eat, how you take care of yourself has an impact on both type 1 and type 2. Dietary factors promoting islet cell inflammation and beta cell damage, so damage to pancreas cells, endocrine disruptors, and other environmental pollutants It may impact metabolism and immunity. All right, so what's being found in our water supply? Fluorides for one, chemicals, yes. What else? Pharmaceuticals, antidepressants, birth control medications, cholesterol medications. All these things are in our water supply. You better filter your water. Otherwise, you're having environmental, endocrine, hormone disrupting chemicals that are in the water supply. So autoimmune primary or secondary maybe have a role in the subtypes of type 2 diabetes LATA. So latent autoimmune diabetes of adulthood or insulin deficient subtypes. So you can have type 2 diabetes and have insufficient amounts of insulin and yet be a type 2. And if that is going on, you need to strongly support the pancreas. And I'll show you kind of one of the things that we do in those circumstances and situations. Associated with possible environmental triggers, again, diet infections. There are different autoimmune conditions like Hashimoto's. Gluten can mimic, all right? The protein gluten in wheat is very similar to thyroid tissue, and eating gluten can definitely increase the odds. So dietary factor triggers the immune system. When your immune system is activated by gluten, it's basically getting rid of gluten from your bloodstream, your gut, and then it's looking at that gluten, and it's like, well, the tissue of the thyroid has a similar, uniform on, that molecular mimicry, all right? Gut microbiome, that was the big one, all right? Gut microbiome composition has been linked to type 1 and type 2, as well as obesity. So out of all of those things right there, what is something we should start doing with just about everybody, I believe? Healing the gut, exactly. Healing the gut. Yeah. Thank you, Drusilla. You follow me? So out of all of those things, something that we can have a massive impact on is gut health, the microbiome. Did you know that they recently announced that we're past the antibiotic era now? We're into the antibiotic resistant era of bacteria and infections and all these things that are going on. We've just overused them. They could have been used in emergency situations, and they had to make more and more stronger chemical compounds that are antibiotics and used them way too much, and yet that destroys our gut. So what do you think a child's risk of diabetes does if they take an antibiotic? Goes up. Because you destroy the microbiome. Shouldn't we be saying, the doctors say, okay, we're at our wit's end. If we don't get this infection under control, that's the way they should be saying it. And the reality is, I'm like 99.9% of people, and I believe that 100% of people, if we were doing the right things from the get-go, from the start, we wouldn't be using any real antibiotics, truthfully. We could use herbs that help strengthen our immune system, our gut, and have our barriers healthy enough. If we had less C-sections, if we had healthier mothers, we'd be able to have more natural births, so it would substantially improve the microbiome. If we were helping women and giving them a year off of work paid like some countries do so they could breastfeed their babies. I got military wives and mothers that have their baby and then in a matter of weeks back to work, and they don't. She's like, I pump, and I'm like, you are a hero in my book, But yet I'm like, our country is ridiculous. Our government is ridiculous. They don't say, you know what, a mom fighting in our armed forces that has a baby, of course they'll say, well, then the mom's just going to get pregnant so that they don't, but don't worry about it. The military members are dealing with the highest infertility rates. So, it's not going to have that bad of an impact on it. I'm just kind of joking around there. It's kind of a frustration, that I see a lot of parents deal with here in Clarksville, Tennessee. There's infertility problems. It's the highest rate in females in the military. Stress and chemicals and all that kind of stuff. But we take care of the gut, and there's a simple test that we can do for that. It's a major component of your immune system. If your immune system is being activated in your gut, or if you have leaky gut, you're going to activate the immune system systemically. You get that under control. You get the microbiome balanced out and repaired or restored. Doctors, again, my thought, do you see how I went, I was about to say a thought, what doctors should do? You know, if we would do those things, if we would say, okay, if we had to use the antibiotic, all right, I'm just kind of playing, not that I never do the devil's advocate, but I'm like, you know, the greater good advocate here. I'm advocating for the good of our children and our society. If we were to say, you know what, why don't we, if we had to use a drug that would destroy and harm the gut, the microbiota, the good bacteria, if it was absolutely necessary to clear an infection to save somebody's life, okay, use it. But now what should we have a protocol to do? Replace it, repair it, regenerate it, restore it. Otherwise, these children, every one of them is an increased risk of diabetes, type 1 and type 2, and obesity. And we're dealing with an epidemic, and we're like, right there, American Diabetes Association, I mean, it's well established in the peer-reviewed medical literature that they are contributing to this, because even if they would say that every one of their antibiotic prescriptions were absolutely critical and necessary for every one of their patients, all right, if they said that, they should at least be saying, by the best available evidence, we cannot leave you in this state because otherwise you're at massive risk of the epidemics that are destroying the health of our children in our nation, really. Children with multiple islet cell antibodies, so progression to symptomatic disease, if they have 3, increased substantially. If they went from 1 to 2, went up massively. All right? So, again, they literally tested these things in this study, tested it, and then watched. So I want to say to them, so if you tested for it and you saw it in these children and you saw the risk, and you know that if their gut was healthy, if we now know that someone can go, they call it remission from autoimmune conditions and diseases, people can go into remission, I believe it's healing. People could heal, they can reverse. They can go from positive antibodies to no longer having those antibodies or having far less of those antibodies in their bloodstream. So why not test? Why not, you know? And you can test for these autoantibodies. Glutamic acid decarboxylase antibodies, anti-GAD, it's into conversion. Islet cell, so the cells themselves. Insulinoma, insulin autoantibodies, so against insulin, not just the cells themselves, not just tissues, but actually hormones in your body can have antibodies against them. So looking at all that, here's a test result of an individual, I believe is 42 years of age. Patient came in, and this is his test results. A unique scenario here. All right, so red, really bad. We're looking at more of a pre-diabetic or into the slight diabetes range, not fully diabetic. Hemoglobin A1C was 5.9, getting up there. Blood sugar is definitely higher than we would like to see. We want it below, 90. 122, all right? Now, what I want you to look at is the 122, the 5.9, so his sugar is obviously higher in his bloodstream than would be ideal, all right? But his insulin is 2, which means it's low. What does that mean? His body is not responding. So this would be considered someone with latent autoimmune diabetes of adulthood, LATA, but it's not truly an autoimmune condition. Eventually, a lot of times they will go towards, and that's where the anti-GAD antibodies. You typically see those go up first before you see the islet cell antibodies. Because what you typically have is you have inflammation of the pancreas, you have poor pancreatic function, the pancreas isn't functioning well, and that can be you just were addicted to sugar your entire life and you just way overwhelmed your pancreas. And eventually it just started to, it just petered out. That was it. So if that goes on and we see that, we know we need to focus on supporting the pancreatic function. We need to improve pancreatic function, and we can work to lower the glycemic index of the foods they eat by changing their dietary habits. We can improve the insulin sensitivity so the insulin that's there in the bloodstream can work more efficiently to pull the sugar out so you're not demanding so much of the pancreas. But gymnema is probably one of the best herbs there is for individuals dealing with that type of diabetes. So Gymnema, it does all of these things. Medicinal properties of Gymnema, again, an herb that is anti-diabetic and lower blood sugar levels, anti-inflammatory, antimicrobial, but it's not antimicrobial towards, it actually promotes good, but helps balance the gut bacteria. And that's what's really cool about certain herbs. They help to balance, they help to improve. They don't kill everything. They're not just destroyers of all bacteria. They help our body maintain good microflora, microbiota balance. Helps with weight loss, antiviral. Many of the, insulin especially, the side effect is weight gain when they start giving these people insulin. Obesity, cataracts, it helps with all of these things. It's been shown to improve all of these things. There's no drug that does that. And it helps with beta cell regeneration, pancreatic cell regeneration. So if we were to say, okay, let's get the, if we see these antibodies high, if they're in this stage here and they have islet cell antibodies. Let's look at their gut. Let's look at their immune system. You'd have to test to figure that out. Because again, it goes back to the superior doctor would prevent it altogether. So that's where restoring the gut, keeping the immune system healthy, doing all those things necessary to reduce the risk to the furthest possible point, to lower it to the furthest possible point would be the best doctor, all right? And that's what I encourage as I work with families. That's what I try and do is teach them this stuff, all right? You guys learning this now can pass this on to your younger generations and your rest of your family members. But if we tested and we figured out, okay, they have the antibodies, all right? And the lab's going to get rich if you do everybody, And I don't even know what the cost on that. Girls always know the cost, so you can ask them. But if you think about it, we'd save money in the long run. We caught them here, said let's restore their gut, we're working on the immune system, let's balance it out, let's clear this infection, whatever it may be. Let's get rid of these toxins that are activating the immune system. Let's test them for food allergies, anything that would activate their immune system. And let's get rid of those things, get their immune system balanced out and under control, they don't progress. And then if they did have that damage and they were way down here already, or down in here, crisis situation, but we could help them regenerate some. Does that make sense? So this is where I already explained it, but Gymnema might decrease blood sugar, insulin. Blood sugar. Insulin is also used to decrease blood sugar. By taking Gymnema along with insulin might cause your blood sugar to be too low. Monitor your blood sugar closely. The dose of your insulin might need to be changed. Now, you'll see if you read on WebMD and these medical pages about these herbs. You'll see they always go, most of these herbs have more research backing them. They've been studied far and wide, way more than the drugs. But they say research is still needed to see if this would be effective therapeutic for diabetes. But yet it's been used for ages and ages. You follow me? That's just their rubber stamp it. Every herb, not enough research, not enough research. There's more research behind herbs than there is drugs. Most drugs are created because of the massive body evidence and research behind, metformin, I sadly forget which one it was. It wasn't Golden Seal, but it was made from an herb originally. So it's like they steal from God. What God already provided, they just steal it from him. And they take all the credit. This is a different situation in testing with this gentleman. You can see his insulin is extremely high, 63. And you can see his blood sugar levels are very, very high. So his pancreas is functioning well, so we just need to really improve insulin sensitivity. This is an insulin resistant situation. That situation before is more of a pancreas going into failure, but yet not an autoimmune condition. Does that make sense? Sensory nerves, discovery in diabetes. It opens the door to new treatment strategies. Read some of the highlights here. Abnormalities in the sensory nociceptor pain-related nerve endings, but yet didn't have to signal pain. Nociceptors are not just going to signal pain. But they said that in diabetes, islet cells become inflamed and are ultimately destroyed, making insulin production impossible or hindering insulin production. Doesn't always have to destroy it completely. And current insulin replacement therapies cannot prevent Many of the side effects, such as heart attacks, blindness, strokes, loss of limbs, and kidney function problems. So this is all from discovery that your nervous system plays a part in the development of type 1 and type 2 diabetes. Sensory neurons are critical for the islet cell function or the immune attack, or preventing the immune attack in essence. Nerves secrete insufficient neuropeptides which sustain normal islet cell function. So let me ask you, if I take the nerves that go to your pancreas and I cut them, what happens to the ability for those nerves to secrete sufficient neuropeptides? It's not going to. So what if I put pressure on it? If I stress that nerve? It's not going to do it as well, right? So why not look at that? Well, they're doing it, just not chiropractically speaking. The medical community has actually started to do groundbreaking research studies. Neurosurgical team actually suggests that artery compressing, they basically remove soft tissue. They see blood vessels and arteries which are inside the spinal canal. So they go and remove those things or reroute them and open up the canal where your spinal cord drops through. They're doing a surgery on the brainstem of type 2 diabetics. And they're reversing type 2 diabetes. In non-obese, it worked really, really well. In obese patients, it wasn't as effective because multiple contributing factors. Am I just saying that go, and I always joke around with people, I'm like, so you got two options here. If you want to check your nervous system, you can go to this neurosurgical team and they can use a knife around your brainstem, have fun with that. Or if you'd like, I can gently move your neck into a better alignment. We'll see if that helps you. Which one most people hopefully prefer. Sadly, there's some people out there, I'm scared of a chiropractor. There's no way I'm getting my neck adjusted. I'll take a surgeon any day. It's more scientific. Anyways. Another cool thing about this study in Surgical Neurology International, it actually said that type 2 diabetes is not genetic. The risk of diabetes, type 1 diabetes in identical twins is, in some studies, it's found up to maybe 50%. A lot of the studies as low as 30% in identical twins. But here's another thing. The identical twins usually live in the same household. Yeah, if they're doing those studies, they would need to identify children of identical twins that were adopted into separate homes to do an accurate study. Does that make sense? All right. So that's the problem. The environment is still the same. And when they look at the risk of a child developing type 1 diabetes or diabetes with a father with diabetes is about 7% risk, increased risk over the general population of developing diabetes. In a mother with diabetes, which was unique because the environment of the mother's body and immune system I thought would make more of an impact, and the research was around 2% increased risk. So it wasn't that big of a familial risk, okay? So, any questions real quick? This enlighten you, help you all, help you hopefully help other people. So tonight what I'll do, I always do this at these talks, these informational talks, and we do this for people online as well. So Ashley will probably get a number that they could text, diabetes free, to the number on the screen on Facebook, or in the future they could do it for YouTube and stuff like that too, right? So that way, if you've taken the time, you've watched this, it doesn't matter whether you're dealing with diabetes or back pain, you could still use this offer. And you can extend this offer to friends and family members.